Fellow Americans, as you're well aware, we are in a war with a virus today in America, and indeed throughout the world. We have set in place federal guidelines for social distancing and both tolerated and encouraged governors and mayors to go even further, mandating lockdowns and threatening to arrest those who decide that they'll take their chances with contracting this virus. We've done all of this despite plenty of dispute over whether this virus is, on balance, all that much worse than other coronaviruses that cause flu-like symptoms, and no evidence that we can eradicate it. At the same time, Wuhan has reopened their wet markets, which is where we were told this virus originated. This, of course, means that there is utterly no reason to believe another virus will not emerge, whether next week, month, or year. The media trumpets top U.S. expert Dr. Fauci, who claims that social distancing is dampening the spread of this virus. Yet if creating a 32% unemployment rate, which is what the Federal Reserve now predicts, along with essentially destroying 90% or more of all social interactions among Americans, was truly the source of the spread of this virus in the main, then within one generation time, or about 5 days, after implementing these measures, the rate of spread of the virus would have stopped. It didn't. What did happen? About 2 weeks later, some slowing occurred, but not enough to matter. Only about 1/5 to 1/6 of all transmission was occurring via social contact, in short. That's what the data shows us in the case rates today. Note that these lockdowns all occur when there are very few cases in hospitals. Shortly thereafter, they trend upward. But despite the capacity to transmit the virus among the general public having been interrupted by 90% or more, which should lead to an R0 or R0 being 1/10 of what it was, and thus the spread of the virus collapsing, that didn't happen. So who's left? Well, we could believe the New York Times, which says that one hospital alone had more than 200 of their workers getting sick with the virus. How about all those who got the virus and weren't sick, since we know that 8 out of 10 or more people who get it either have a very mild course of disease or no symptoms at all? Why aren't they all quarantined? Well, they're essential. They're not locked down. They go to and from work, they still live in their homes, they travel on public transit and in private cars, and after working in what is best described by a doctor in that same hospital as a petri dish, they then go back into the community, into the stores, pumping gas in their cars, pushing elevator buttons in their apartment buildings. And I remind you, they spread the virus all over the community. China figured this out. There's a document out there that mandates that all persons working in any part of a medical facility where COVID-19 patients are may not leave. They must live in an isolation unit. Not just doctors and nurses, but all the support and technical staff too. We instead treat our medical staff as heroes when the weight of the evidence is that the spread into the community is continuing through them. Consider a circumstance where you have a county in which there is no measles vaccine and nobody has had the measles. Therefore, everyone is susceptible. One day, a young man drives up to the ER, gets out of his car, and walks in. He says he came from another part of the country. Didn't stop anywhere except your emergency room when he felt sick. He's shown to a room, and you as an MD walk in to see him and realize instantly that he has the measles. How many people has he contaminated? What surfaces has he contaminated? What's going to happen when the people in your hospital, from the receptionist at the desk to the guy pushing the meds down the hall in the ER, all of whom were potentially exposed, go home? I remind you that as with this disease, the measles can be transmitted for 4 days before you get a rash. What is about to happen to your community unless you prevent every single person in that building who might have been exposed from leaving and forcibly isolate every single one of them? This virus is a bit different in that it's apparent that social transmission is very inefficient. But transmission from seriously ill people, which by definition those in the hospital are, appears to be very efficient. PPE is ineffective. Our hospitals are simply not set up for infectious disease of this sort. When will the transmission rate finally start to drop if we don't change what we're doing? When all these people get the virus and have seroconverted. In fact, if you look at a rather simple mathematical model, you will see that this takes about 2 to 3 weeks from the time we first start alerting in a given area. How long will that take? In a large hospital with hundreds of staff members or more, and especially with one that's getting help from people in other states coming there to work, a very long time. So why are we locked down again? The general public isn't the problem. The data tells us this with certainty. Telling people to stay home when they're sick would do the same thing, except for one small problem. We don't do that with the health workers, do we? No, they're essential, and so the virus gets spread. Fortunately, we have a nation where they figured all of this out and how to interrupt it. That's Singapore. With a relatively simple change in their healthcare environment, they put a stop to transmission back into the general public from their healthcare workers. China appears to have figured it out as well, but they went even further. And in our society, whether we'll stop calling people heroes and instead go where the facts lead is not clear. But the data is clear, my friends. We're destroying our economy through futile measures while hundreds of thousands of typhoid Marys continue their work. There are, in fact, based on the data, only 3 options. Every person working in a hospital must wash their damn hands every single time before and after you touch any person or thing. For every person working as a medical provider, without exception, this must be the rule. I don't care if you're environmental services, a nurse, orderly, doctor, or whatever. No exceptions. Make one exception, one time, you're under 14 days quarantine, and you're fired. Period. If that proves insufficient to immediately drop R0 under 1.0, in other words, the medical worker simply will not comply, then every single person entering a medical provider space where even one person is suspected or known COVID-19 positive must isolate on grounds until this is over, without exception. Or number 2, we can wait until all the people who work in these places seroconvert. They will. They'll all get it, and so will we. It won't matter what the government does, how many lockdowns they do, how long they're maintained, or how many times Trump, Birx, and Fauci lie. The transmission will not stop because we will not get the reproduction rate under control. The facts are that social distancing, lockdowns, forcible cessation of commerce, and dropping the social interaction rate of the American public by more than 90% doesn't get the job done. Or number 3, we can set up quarantine hospitals where all COVID patients go, and nobody who is not sick or isn't seroconverted can enter. All workers must be antibody positive. Now a simple shower with hot water and segregating clothing is enough, since you can't take it out of there other than by physical contamination. And if you're positive with an active infection, you cannot leave until your case is resolved. Problem with option number 3 is that as it stands right now, we probably don't have enough medical workers who are seroconverted to be able to staff those places. Down the road, if we pick number 2, which is what we're doing right now, we'll have number 3. What'll be left of our economy at that point is unknown. Singapore took option number 1. They dropped the transmission rate to healthcare workers to a statistical 0 simply by mandating hand washing at what we would consider an anal basis. And immediately thereafter, their outbreak was over. They still got infections here and there, and in fact, they're getting them today. But there is no wide-scale spread. The simple facts are that community transmission is just not efficient enough at passing it around to maintain that R0. Those are our only 3 choices, folks. And right now we're doing number 2. This will force us to keep lockdowns or worse. We'll release them and the bug will come roaring back in the fall when co-infection with flu will be common, killing many more people than otherwise have to die. There are only 3 choices. And the option, ladies and gentlemen, is yours. May God bless America.